My name is Jim Haig. I'm the president of the Senecare Corporation. And for 30 years, we've been making the finest IV poles in the country. But in all those 30 years, there isn't a hospital that's come by and asked us, is there some way that we can bring an IV pole and have it attached to a wheelchair for people being transported through the halls. So often, for many years, this process of having a patient in a chair on an IV pole, they have to go through the halls with one hand on the patient, one hand on the IV pole. Many times what they have to do is they have to take equipment, i.e. the pumps, and put them on the wheelchair, which is typically an unstable platform. So what we've done in this new product that I'm introducing is we've taken a normal wheelchair and turned it now into a super chair. Let me explain. Now we can sit down with a patient, we can sit down and take an IV pole, couple the two together, and be able to manipulate this through the halls and safely transport not only the patient, but then the employee is able to sit down and keep his feet from being entangled by the legs of the IV pole, be able to keep and dedicate all of their attention actually to the patient. So if there is an O2 cylinder here, or there's some personal items, I've got enough room back here to be able to sit down and have that and still stand up straight. Many times we're asked to transport a patient that's in the 200, 250, 300, and even 400 pounds. This increases your leverage by almost 50%, giving you the ability to handle bariatric patients basically with ease. And what we try to do, number one, is change the ergonomics of this. On a normal wheelchair, you're standing in here. When you're inside this cavity, the wheels prevent your feet from doing things what you want to do. You have to end up many times bending down to push a very, very heavy patient like this, causing fatigue to your back, and sitting down and causing an ergonomic situation that's unhealthy. So what we've tried to do with these is cause a tremendous reduction in injuries. What we've also tried to do is give you the control of, so if you're going on and off an elevator, simply the pole follows you. It can be then put to the side. You can get on and off the elevator and then reunite with your IV pole, and now you're easily ready to transport. Full control of your product, full control of your patient, and now full control of your IV pole for the first time. And then what we really want to do is we're trying to sit down and cause this device to be able to making safety as a major issue, making fatigue a major issue, and making this as an anti-theft device. So often in a hospital situation where there's an unintended area, these poles have a tendency of finding their way into the trunks of cars, and they leave the premises unauthorized. So this whole stair can tilt function normally. It can fold, so it doesn't take up any more space. But now this reduces the ability of this to be, again, leaving the premises without authorization. These are very easily attached. We send a tool right here. This screws are allowed to be tight. Basically, you remove your old handle, slide this on. We provide the tools for you to attach this. And once it's on, these carry a 10-year guarantee. We've also got thermal protection here in the event you're out in an area which is has reduced temperatures. So your hands are comfortable, and then these can follow the chair. So once these are attached to an old chair and the chair wears out, you can just basically replace them to a new chair. So we offer a 10-year guarantee in these things, and we're quite proud of the ability of this to take and make it into a super chair. So what we're doing is we're offering a free trial for all of our hospital and all the hospitals throughout the country. We're going to offer a free trial. So call us at 1-800-433-0348, and we'd be more than happy to send you out a free trial. So I hope that you confirm all the things I've told you is true, and I think you'll find that these things will pay for themselves basically in 30 days. All right, thanks very much.